Can we honestly say that in this country we offer satisfactory care to people with complex mental health problems? File on 4 on Radio 4 this week looked into mental health services, throwing up evidence that patients are often sent by the NHS to stay in rehabilitation units a long way from home with untrained staff. Now, we're talking here about units that might be run by the NHS or by independent providers, and which treat a few thousand patients a year who are too challenging for standard hospital settings. While the aim, of course, is to help patients recover and manage their conditions and re-enter the community, some have remained there for 10 years or more. Well, one PM listener contacted us when she heard about the File on 4. Rachel Bannister wanted to tell us about her daughter's experience, being sent to 3 units very far away. Rachel is also chair of a charity, Mental Health Time for Action Foundation.
My daughter has struggled for a number of years, mainly with an eating disorder, but also depression and anxiety. It's been an ongoing problem over the past few years, really, since she was a young teenager.
And where did treatment start?
She was seen by services fairly quickly. And this has always been my argument with politicians, really, that it's not just about being seen, it's about being treated. And she didn't have access to that. It was just very patchy. Me, it was my first experience as a mental health service. I didn't know what to expect. And I think rather naively, I just thought, well, if she needed more, they'll offer more. And this went on for almost 2 years, to the point where her mental health and her physical health became really acute. And then we were told, very suddenly that she now had anorexia and she needed to be hospitalised. And then we had the horror of finding out that there weren't any beds locally, and she was sent 50 miles from home. 50 as a specialist unit, and actually it was really good care, but obviously it was a new team. And by the time she'd got to know that team, build up a therapeutic relationship with the psychiatrist and with the therapist, then the commissioners pull the funding and you're back into the community. So she was physically stable, still very mentally unwell, and she'd been away from home for 10 months and she was a teenager. She had to do her exams in the hospital, and however good that care was, she wasn't sleeping in her own bed at night. She wasn't being supported by those who love her. But then then abruptly you're back in the community and there isn't a step down rehabilitation package. There was nothing. And so the cycle started again. So she just stopped eating and drinking and ended up on a general ward for 4 weeks, and then she was sent 100 miles from home. By this time, I was just utterly despairing, really. I mean, I'm no fan of driving. I've got 2 other daughters here. I was trying to work as a teacher, and it nearly broke us, that did. But it was a month there. Then she was on a unit that was close to home, but it didn't have the specialist skills. And then we ended up 300 miles away.
300?
So it was 300 miles
that's
away.
Ridiculous.
And to get that bed, and we had to fight. I had to basically say to the commissioner's care coordinator, I'm going to go to the media. She's dying here. She needs a bed. Please give her a specialist bed. A consultant that had reviewed her said she needed that specialist bed.
What needs to happen, Rachel?
So we need to look at, and I said this to Jeremy Hunt when I met him, we need to look at really good, positive examples of community care which do exist. I've been to a hospital in London that treats young people who are as sick as my daughter in the community. The real horrors of this story is that everybody, apart from one family that we know, that was hospitalised with my daughter when she was 300 miles away, they are still in hospital. And some of them, sadly, have also lost their lives. And that just isn't good enough. You wouldn't send somebody with leukemia, a child with leukemia, 300 miles away, would you?
Wouldn't.
Of course you wouldn't. That would be an utter disgrace. And this is an utter disgrace. And Jeremy Hunt promised me in 2017 when I met him, he looked me in the eye, and I trusted what he said when he said out-of-area placements will end by 2021. But they haven't ended.
I'll just say that the Department of Health and Social Care do say they're rolling out integrated community mental health teams, and they say that is going to give hundreds of thousands of people with severe mental illness greater choice. Is it getting better?
I'm not seeing it yet. We need to see health ministers, looking at the places where it works and following those evidence-based examples. But we also need to remember that when they talk about extra money, it isn't extra money. What we need to do first is to repair the cuts that have happened over the past decade and then put more money and more staff back in. And I think we need to do something to help retain staff, but also to make mental health something that's a career that people want to do. Because at the minute, would you want to come and work in a mental health team where you haven't got, if you diagnose somebody, but then there isn't a therapist or a psychologist to support people?
That was Rachel Bannister, who contacted us wanting to tell us about her daughter's experience of mental health services.